We will be recording this evening's program, and it will be available on the Westminster Presbyterian Church YouTube channel. So for people who were attending another Peace Week event at the same time tonight, will have an opportunity to view the video at a time that's convenient for them. My name is Sue Linderman, and I'm delighted to welcome you all here tonight. This evening's program is being incorporated into the events of Peace Week Delaware. This program is sponsored by the Peace and Justice Work Group of Westminster Presbyterian Church in Wilmington, Delaware. The Peace and Justice Work Group was founded in the spring of 2018. Hard to believe it's been more than 3 years, with the twin goals of combating violence in Wilmington and promoting racial justice. This is one of the significant initiatives of the work group. It is a series of weekly education events that began in July of 2020 and has been offered every Thursday evening at 7 p.m. via Zoom. A wide-ranging series of topics has included presentations and videos and discussions on issues of race and justice, the environment, advocacy, reform, legislative initiatives, pretty much from soup to nuts in terms of work going on and work to be done in our community. So we invite you to join us each week for a continuing series of topics. And I believe at the end of tonight's program, Lynne and Rita will discuss a follow-up to tonight's program that I'm sure that all of you will be interested in attending. So tonight, our topic is to focus on growing a community violence prevention intervention initiative. And our featured speakers are Rita Landgraf and Lynne Kielhorn. Rita is currently a professor at the University Delaware, and she has had an extensive, I didn't say long, because you're just not old enough for it to be long, an extensive and illustrious career in human services. She led the state of Delaware's, sorry, let me start back a little bit. Prior to joining the faculty at the University of Delaware, she served as cabinet secretary of the Delaware Department of Health and Social Services from 2009 through 2017 as part of Governor Jack Markell's administration. As secretary, she led the principal agency charged with keeping Delawareans healthy and ensuring that they get the health care that they need. She led Delaware's successful efforts to meet the requirements of the settlement agreement it entered into with the U.S. Department of Justice, with the goal of promoting recovery and community integration of individuals with serious and persistent mental illness. The United States Department of Justice recognized Delaware for being the first state to achieve this level of transformation within the stated 5-year timeframe. She was also responsible for the state's implementation of the Affordable Care Act. No small tasks. She currently serves as a member of the Democrat Governors Association Healthcare Advisory Council and is on the board of the Delaware Center for Health Innovation. She's a former executive of the National Alliance on Mental Illness, NAMI, in Delaware, and the ARC of Delaware, which advocates for people with intellectual and developmental disabilities, and is also a former president of AARP Delaware, having taken that on well before she could get her very own AARP card. Our other speaker, Lynne Kielhorn, has spent most of her career in biotech, including early years at DuPont, and then as a co-founder of Nanodrop Technologies. In the last few years, she has become a full-time citizen advocate, focused initially on urban gun violence, and more recently on social justice issues. She has leadership roles in the Peace and Justice Work Group of Westminster Church. Excuse me, my Zoom is talking to me, of Westminster Presbyterian Church, the Campaign to End Debtors Prison, and the Delaware Poor People's Campaign, with a particular leadership role in the Fines and Fees Initiative, currently continuing its efforts to gain legislative approval with the upcoming legislative session. And she's also very active in the Coalition for Smart Justice, especially regarding police reform. So now that we have spent the entire evening's program describing our two speakers, I'm going to turn it over to them for tonight's program. Welcome.
Thanks, Sue. You can go ahead and put up the PowerPoint if you can. And I'm hoping we will keep tonight's presentation very informal. I will start out doing some background and history to set the context, but I hope you'll see we'll do some back and forth throughout, and feel free to raise your hand at any point. You don't have to wait till the end if you would like to ask a question or add a comment. The more we can make this discussion based, I think the better and more fun it will be for all of us. Go ahead and go to the next slide. So the first thing we want to do is really properly frame the issue. And in that regard, we really want to make sure that we recognize gun violence as a public health issue. And so I'm going to take a little bit of time now to explain how and why that is the case. Next slide. So the traditional lens would have us viewing gun violence as a public safety issue. And indeed, gun violence is a crime. And the criminal justice system has a very important role to play, therefore. And the criminological frameworks do inform many of the solutions. We all have to recognize what is referred to as rational choice theory, where criminals are self-interested, rational decision makers, and therefore we need to focus on changing the input to those decisions. There's also something called routine activities theory, recognizing that crime occurs at the convergence of routine activity patterns of likely offenders, suitable targets, and lack of guardians. So there's certainly a role there to play for the framework of criminology. But all the evidence we have and everything know clearly says that we cannot police our way out of this problem. So that is the bottom line message that we need to understand regarding viewing it as a public safety issue. Next slide. So like Gary said, we want to instead view gun violence as a public health issue. I think it was summed up best by a former CDC director, David Satcher, who said, if it isn't a health problem, then why are all these people dying from it? And I think that pretty much sums it up. We have to recognize that violence is population-based, so that beyond the injury itself, the trauma of the experience leaves scars on not only the individual and the families, but the surrounding communities in which they live as well. And violence can actually be transmitted and can reach epidemic levels. So it ends up having features of truly infectious transmission, clustering in space and spread in an epidemic or non-linear fashion. I like to think of it this way. If you have a friend or an associate who is a perpetrator of violence, that makes you having that closeness or that contact with that person. It puts you then at high risk of being a victim of violence or a perpetrator of violence yourself, just by having that person in your social network or being associated with them in some way. And that again is how we see it as sort of transmissible and related to the social networks and the folks associated with individuals. So violence is preventable, it requires intervention and changing of the cultural norms in the community. Okay, so the other thing that we need to recognize is put this in the context of other public health problems. And as the title says, violent intentional injury is the most poorly addressed public health problem in America. So on this slide, on the vertical axis, we have how much the US spends in billions of dollars on each of the top 30 leading causes of death. And on the horizontal axis, you have the mortality rate per 100,000 population. And you can see most of them sort of cluster along that line, except for gun violence is a clear outlier on that, in that it is has a very high mortality rate, yet receives very little funding. And that is something that needs to be addressed. The good news is that our own President Joe Biden does recognize this as a public health issue and is committed to putting significant funding into public health preventive measures for gun violence. Next slide. So now let's look a little bit at the history of Wilmington specifically. All the way back in 2013, Wilmington experienced 127 shootings, resulting in 154 victims. And those numbers not only were bad, but it was also recognized that Wilmington at that point in time was an outlier in terms of the trend lines. So at that time, most states were making significant improvements in terms of the gun violence. Delaware was one of the exceptions, and a major exception. From 1999 to 2012, Delaware significantly increased in those statistics. So Wilmington, of course, was driving those Delaware figures. So we were an outlier. Hanifa Shabazz, who was then serving as Wilmington's councilwoman, recognized that this was a crisis, the gun violence was a crisis, especially among the youth, and that it required a public health response. And so she introduced a resolution in City Council requesting that the Centers for Disease Control and Prevention assist Wilmington in investigating gun violence as a public health issue and providing recommendations for action. Next slide. And so that's where we get to Wilmington truly being a case study. Because there are congressional funding restrictions on the CDC when it comes to conducting research related to guns, it's not something that the CDC had done a lot of work in. But our local officials were able to carefully craft a pitch to get around that so that the CDC could indeed come in and investigate looking at the gun violence as a public health issue. So it resulted in a very rare look at shootings by the federal agency. The end result was the issuance of a report in November of 2015 titled Elevated Rates of Urban Firearm Violence and Opportunities for Prevention. And that was submitted to our own Rita Landgraf, who again was serving as the Secretary of Department of Health and Human Services at that time. We also should recognize that at that point in time, public health experts really did hold up this report as an example of what could be achieved if gun violence was viewed and treated as a disease. So with that, I will go ahead and turn it over to Rita, who's going to take us through what we learned from that report and some of the progress that has been made since then.
Thank you, Lynn. And again, I think Lynn did a fabulous job at kind of setting the table relative to viewing gun violence from a public health lens. Having the honor of working with the Center for Disability Studies during this time frame, who really took this for them as an opportunity to use Wilmington as a case study. If you think about violence, it is not only just occurring in the city of Wilmington, it occurs across our country and in very dramatic ways. And the scientists being able to really do a deeper dive into the root cause of this violence. And in doing that, they needed to obtain data for this level of research. And so what they acquired were what we call these administrative records relative to those who were perpetrating gun violence, looking at the number of individuals and what did their medical records reveal. Were they involved in the medical aspect? Were they involved with the child welfare system? Did they have involvement in the criminal system? What was happening relative to employment and what was happening with their education. And what we learned from these data sources is that there were common indicators that all perpetrators of gun violence at this particular time shared in these individual pillars. Next slide, please. So the CDC looked at what are the risk factors also of all the individuals at this particular time that were committing gun violence. What we learned is that they were living in impoverished conditions, that they had low educational attainment, that they had unstable households, that many times there were adverse childhood experiences, history of abuse as a child, that they were themselves exposed to a level of violence. And many times, some of them were impacted by gun violence themselves or some level of assault, so that they were victims before they actually became perpetrators. Next slide. And at this particular time, you will see here the percentage. So those that were involved in child welfare investigation histories relative to child maltreatment, 28% of those individuals that had perpetrated gun violence had been involved with the child maltreatment system. 7% were actually displaced from their home. Many, 54% were part of the juvenile service system. 50% were on community probation. 38% had a residential detention. And when we looked at the education system, that data, we saw that the recipients of assistance programs were at 73%. Each individual, 42% of which had either a prior suspension or expulsion. 24% had actually dropped out prior to their high school graduation, and 58% had greater than 10 unexcused absences in the preceding school year. The one data point that we did not get information on were individuals that were tardy in school, but all these are common indicators relative to really better understanding who is at risk or who has the vulnerability to perpetrate gun violence. Next slide. So what key insights did we get from the CDC science-based study? That there are and still remains a very small number of people who are actually involved in committing these firearm violences. So accurately focusing on preventative efforts should lead to a rather significant impact. That based on linked data, a scoring tool of multiple risk factors can really predict the vulnerability of future violence. So to focus our efforts is possible in intervening and preventing this level of gun violence that we still see occurring, in our city, but even across our state. That the best use of our resources is to continuously focus on evidence-based wraparound services on those who are at the highest risk of vulnerability to commit crime, and to recommend optimizing and then implementing the CDC, what they refer to as a predictive model. Based on these indicators, we can actually predict who has the highest level of vulnerability, and we can begin to intervene before trouble actually occurs. Next slide. So what the CDC really asked us to do is to think about how could we utilize this data in a proactive way, and how do we share it amongst relative organizations to indeed support prevention and intervention, and connect that data to identify people prior to the vulnerability of committing gun violence, and to create an advisory council to really focus in on how do we develop this prevention and intervention strategy in a coordinated, customized fashion. Next slide. So the examples even back then that the CDC report highlighted, because this isn't a one sector solution. This needs to be a multi-sector solution. It also needs all of us engaged. It doesn't belong to one sector, to one role in government or in the private sector. What the key is that we align together in a variety of approaches in a comprehensive fashion. But some of the evidence-based practices and services that really work relative to supporting intervention are hospital-based violence intervention programs, community-based violence prevention and intervention programs, which encompass street outreach and violence interruption, which also are individual and family-focused supports that offer job placement. I do want to say something about the employment side of this. Out of everyone who committed gun violence in that reported time that the CDC did their study, there was no one that actually was in employment who committed gun violence. So we know there's a correlation, a causal effect between that unemployment and that vulnerability. And that people receive therapeutic support, counseling, the trauma impact. I mentioned adverse childhood experiences, which actually cause post-traumatic stress disorder. Well, we really need to encompass all of these things as part of a community-based violence prevention and intervention program. Communities themselves are victims of trauma whenever gun violence is present. Even if they weren't impacted directly by the gun violence, they are absorbing it by being in the community that feels the impact of gun violence. And also education-based violence prevention programs, engaging individual and group school-based social and emotional learning. You saw the statistics relative to those individuals who had already committed gun violence. That was most telling relative to the education component, many of which individuals just dropped out or were expelled or suspended. So key elements that the CDC also highlighted. I wanted to give you a snapshot. The CDC did their work. We started this in 2013. They really took their time in looking at data sources. So from 2013, giving the state their report on 2015. So now let me bring you up to 2017. And this appeared in the news journal, Delaware Online, that kids, our youth, are more likely to be shot in Wilmington than any other US city. And I just want that to sit with you for a while. So this impact is huge, and especially, the impact on our youth. Next slide, please. So where are we today? What is the progress that we have made since the CDC came to our state? There has been investments, rather small investments, from philanthropic institutions and even the state itself that started in 2018 to more or less support what we are calling a skeleton or a pilot community-based programs. But they're kind of fragmented and they do not have that comprehensive approach that we have been highlighting for you. We do have a commitment from Christiana Care to invest in the hospital violence intervention programs, and that started back in 2019. And then in 2020, a launch to put on a hold due to COVID. Of course, there was a disruption because of our pandemic. There has been a relaunch in this support now in 2021. And if you noticed, there was a law that occurred relative to gun violence when pandemic hit. But unfortunately, 2021, we are seeing actually gun violence at a higher level than we have ever seen before. At the state side, there has been significant investment in a group violence intervention program called GVI, and that began in 2019. We're going to talk a little bit more about what that program is focused on. So 5 years after the CDC actually completed its first of its kind look at gun violence from a public health lens, and Wilmington was where they based their case study, Delaware officials have largely abandoned one of the agency's key recommendations to preventing this level of bloodshed. And that's why we are framing this from a call to action framework. And we know that as the government really looked at database sharing recommendations that the CDC put before us, they ran into ethical concerns and other shortcomings that really led them to pursue a whole different violence perspective and strategies to address the violence that is occurring here in Delaware, and to really lean in on those who are currently committing gun violence rather than going upstream, which is a public health strategy, to really promote the prevention and the intervention at the time that you see vulnerability prior to committing gun violence. I'm going to pause here and just ask Lynne before I go into GVI, if you wanted to add anything to kind of sum up that piece of the presentation. Oh, you're muted, Lynne.
Sorry.
No, it's all good.
Not really, only to say that as we get into this next set of slides from GVI, which are slides prepared by the people implementing that program, that it is a law enforcement based program. It does pull in other partners to work with it, but at its core, it is a law enforcement based and driven program. So that is a different way of looking at it and counter to, in some ways, the public health perspective that we feel is the right framework and the right lens to be viewing this. The state has chosen to invest heavily instead in a law enforcement-based program, which again does have, it is an evidence-based program. So I'm not saying it's not a worthwhile program, but it is just one piece of what most of us who have been following and tracking all the different programs across the country that are out there, what's working, the communities that are doing the best are the ones that have programs in each of these areas, driven from from law enforcement, the hospital-based programs, and the community-based programs. And the communities that are having the most success have each of those components. And in Delaware, we've really, in terms of investment, have focused almost solely on the law enforcement based.
Thank you, Lynne. So think of it as like the three-legged stool, as Lynne has indicated. Not one all these strategies have merits. It's that resource and how do we value that comprehensive approach to eradicating gun violence? And without that comprehensive approach, and you could even put a fourth leg on the stool, although we're not going to go into depth and discussion around gun safety policy, but indeed what we wanted to bring to you today is that three-legged stool approach with comprehensive intervention and a focus on prevention. I mean, we don't want this level of gun violence. We really want to be able to prevent and intervene. So moving you up to July 2019, as Lynne said, the government really leaned on the public safety side of intervention. What we term now GVI is group violence intervention. It is an evidence-based intervention model. Really one of the biggest advocates for this is David Kennedy. And really David Kennedy had brought this model to Delaware even while I was still in our office and had talked about the merits of this model. Next slide, please. And so what the CDC didn't say relative to the approach for this GVI is the CDC did not concentrate on groups or gangs. Remember, their focus was on prevention of vulnerability for gun violence. So the report did not address the role of group-driven gun violence in our Wilmington landscape. And Wilmington's gun violence is perpetrated on a basis by less than 1% of the city's population. The CDC actually did validate that statistic. GVI is indeed a strategy that exclusively addresses the highest risk target population. But let me be clear, what they mean by highest risk target are individuals who have already in some form committed violence, not intervening beforehand. Next slide. So what are their key messages? To meet with group members and to really lean in hard on clear messages and a coordinated action. More from that moral voice. Your community does not accept these actions of violence. You are the ones who are hurting our community. And in addition to that moral voice, bringing in social service support. So it's kind of like the carrot and the stick. The social service support is the carrot. We really want to help you, and we will do whatever we can to help you for as long as you need it. So the ability to have those social services, if you mend your ways and you follow this framework. And from the law enforcement, here's the stick. If you continue shooting, you and your group will receive full attention of law enforcement. And here is what will happen if someone in your group shoots, etc. Right? So you are all, your group, if there's a bad egg in your group, you all will pay for that. And that's where the carrot and the stick, comes in as an incentive. We'll give you whatever you need to get employed, housing. If you follow this lead and stop committing this harm to our community. But if you don't, and members of your group do not follow suit, then we will prosecute you at the highest level. Next slide, please. You okay, Sue? There you go. So how they do this is they call that interaction a call-in. And what that is a face-to-face meeting that they have with these individuals and their group members and community figures, and they bring in social services and what they call group-involved adults. And typically right now that are, as they started this program, those on probation, and it is to reiterate that message. And to make sure everybody hears that message, and that message is cascaded throughout that group. And then, so it's almost like the train the trainer models. So that message gets out to the streets. Next slide. A custom notification of GVI is when the leaders and law enforcement actually visit with key adult group members even in their homes or on the streets, to keep that anti-violence and continuously, really promote that message and keep it alive. And also to engage with juveniles or their legal guardians to introduce or reinforce this messaging, and then also offer the availability of supports. They call the next level of notification is in reach. And this is when they actually go into the prison system where people are incarcerated, and even at a juvenile level, while juveniles are in our detention system or the residential system, to continue from a messaging this anti-violence and proactively offer services pending their release back into the community. So, before people re-enter back into the community, how do we break this violence so people don't go back to the activities that they were involved in that got them into incarceration? Next slide. So what you just saw was, the GBI approach and intervention. The next approach, and when we talked about the three-legged stool, is the hospital-based violence intervention strategy. And really, Christiana Care and Dr. Chen in particular has been a very strong advocate for promoting at a hospital level this hospital-based violence intervention strategy, and really, listening to the lived experience and empowering the victims themselves of lived violence. So Evolve is empowering victims of that lived violence, and really, looking at a trauma-informed approach to assist the patients that come either through their emergency department or their trauma department that have literally been, personally impacted by gun violence. And what they do at Christiana Care is they engage with the patients in the path from healing from a traumatic injury, and then maintaining these long-term connections to identify and achieve that patient's goals. And many times that might also involve their family members. And then to do that connection with patients and the community resources and the support services as well. Next slide. Now, where are we today? And really, when I say, Sue, can you go back a slide? Really, when I say today, this data was through, there we go, through May. And as you're seeing, that these shootings are continuing. So I want you to think about, this was spring 2021, but it just gives you an indication on a chart of the visual snapshot. When you look at the shooting data to the left of this slide, you will see starting in 2011, remember the CDC started their work in 2013, and how the incidents, which are the blue line, the victims, the individuals actually impacted is the gray line, and the gold line are the individuals that have lost their life due to gun violence. And then to the right, you will see shootings year to date through May 3rd, 2021. And, starting again from 2011 with the blue line with the incidents, the gray line with the victims, and the gold line with the individuals that have lost their life to gun violence. So you will see from 2013, when the CDC started looking at our statistics, to where we are today in 2021, we still have, a way to go relative to prevention and intervention of gun violence within our city. Next slide, please. So what we wanted to really hone in on today, so you saw the, intervention from the GBI perspective, the hospital perspective. Now we really want to lean in on a community-driven prevention and intervention. And as I said, it takes all sectors. It doesn't belong to just one. And community plays such a vital role in this. We all do. So the Wilmington Advisory Council, which was originally set up by the CDC's work to bring forth recommendations relative to prevention and intervention, that body actually now is a 501c3 and really committed itself from the time the CDC made the recommendation that it be created. The CDC's recommendation was that it would be time limited, but that body actually wanted to extend itself and really stay connected relative to how do we focus on prevention and intervention. The belief, the value that the Advisory Council has is really that augmentation needs to have a driven approach, one that will complement, as Lynne said earlier, the law enforcement approach to build that comprehensive public safety model to really foster strong communities where our youth and families can thrive. So it's not just to eradicate gun violence, but it's really to bring forth opportunities that foster strong neighborhoods where our youth and families and community members don't just survive, they actually thrive. Next slide. Lynne, I don't know if you want to add anything at any time, Lynne, you just come off mic and I can see. So our prevention initiative is really thinking about the science that the CDC brought forward many years ago and honoring that approach and advancing that work forward that really, again, concentrates on preventative measures and intervention measures. And to reduce that and promote really with a keen focus on our youth development, along with our community resilience by that comprehensive approach across 3 pillars that I will be sharing with you that bring universal prevention, that bring selected early intervention supports, and indicated intervention. And this approach is the use of evidence, again, evidence-informed practices to create a collective impact, trauma-informed practice, presenting skills for psychological recovery, which are actually evidence-based, that are used in disaster situations. We call this SPR. So whenever, if you want to think of a weather disaster, people come on site to support the community members impacted by that disaster with skills for psychological recovery, as well as providing comprehensive, intensive case management. That's not prescribed by limited time. It actually is there for as long as people may need it to advance the intervention. Next slide. So what do we mean by community driven? That this is really not a top-down approach, it's a bottom-up approach. And looking at those strategies along with the people from the community and co-developed, co-created, co-engaged with grassroots organizations that are really trusted by the community. This level of violence really breaks trust of community, and building on the strengths of the assets of that community while continuing to build the capacity in what we call a community of practice that we all learned together as a community of practice. So the proposal that was created really focuses in with the Center for Structural Equity in partnership with Network Connect, Stop the Violence Coalition, United Way of Delaware, the University Partnership for Healthy Communities, which I have the honor of directing, Minds in Motion. These are the organizations that are coming together to really look at how do we create this collective impact proposal and support to our communities. We've been engaged with the Wilmington Community Advisory Council from the beginning, and drawing from those recommendations of that original report. It aligns efforts with community-based violence already prevention programs, so it adds additional value to what's already been going on in the community, but again, in a more comprehensive, coordinated fashion, and builds that integration of that community of practice. We're not trying to duplicate efforts, but to continuously add value and lift off these community efforts. The Center for Structural Equity has been doing this work, and actually in alliance with the hospital intervention programs. And really, the best work they do is on the street work, but we're looking at how do we also strengthen their administrative infrastructure, because we know in order for them to be strong, that it will also take a strong foundation from that administrative infrastructure in their operations, managing partner, and backbone organization. We are also including a research and evaluation component to really look at what outcomes does this level of prevention and intervention really secure, and what is the impact over time, but also the impact in real time relative to the youth and the families engaged. Next slide. Our goal is to create positive, caring, safe, consistent environments. I mentioned to you the universal strategies, and I just wanted to give you kind of an overview of what does that mean. Again, our focus are on our youth. Universal strategies actually hit the universe, if you will. The goal is to create strong operational systems and develop open communication channels with all our youth and adults who care about them at the heart of the universal supports. And the major focus in universal strategies is programming for prevention. Our selective strategies are actually things you can do for youth when you, at the earliest sign of identification of what I'm saying is trouble, which we probably all have seen that, and that our youth might need more problem-solving supports. These are generally group-based strategies that remediate specific skill deficits. For example, youth not getting along well with others could be provided a mentor to actually help them build their communication skills. And at this level, the goal is to build the lagging skill and ultimately to prevent youth from needing more intensive, which is our next level, indicated strategies. So this would be like the first sign we see somebody struggling in an unhealthy way. How do we start supporting them with a selective, and usually that may be a group intervention. Indicated are when we see youth at the greatest risk. And that these youth may be experiencing, very complicated, complex, long-standing challenges that keep them from even, building intimate, trusting personal relationships, and even being able to access help when needed. Without these supports, youth are at this level are likely to experience more adversity, negative consequences that really will restrict their overall development and autonomy. And it is important to engage as many social assets as possible to support them in their own healthy problem solving, resource management, caregiving, mentors, youth workers. So this is at the highest risk that we start seeing. Next slide. So the proposal, we can break it down into what I term pillars, intervention pillars. And these are just some examples of what this proposal is really adding value to that support network. So at that universal level, the grassroots organization Network Connect could fulfill this work. And you see on the right, the variety of programs that that could support a universal youth strategy, and the ages that we're focused on at the universal level, 10 to 17. Selected youth, this is that early intervention, first sign of trouble. This would be the Center for Structural Equity. And you see the engagement that we're proposing here relative to adding value and resources to support those who we deem are in that early intervention selected stage. And we're looking at, as part of this pilot, serving 80 youth that would fit this profile, looking at the ages between 14 and 18 years old. And what I want to also highlight for you, the CDC, some of the struggles that you started seeing in their data relative to expulsions, being expelled, dropping out of school. This level would engage education advocates who would be connected to these youth and really trying to keep them focused on engaging at their education level and making progress, as well as focused on workforce development. And we are adding arts and culture, the value of arts and culture, even in how we express ourselves, how we problem solve. And the indicated youth, which is that next level, is really the intervention for those who are at highest risk of unhealthy behaviors. And so again, looking at 80 youth in this category and focusing in on older youth starting at age 16, but all the way up to the age 24. Brain science tells us that our executive functioning is not completely developed until the age of 25. So problem solving many times is just vulnerable based on brain development, and many times, at high risk if people are already have the vulnerability based on the indicators that the CDC had shared with us relative to those who had already committed gun violence. Next slide, please. So what we wanted to bring to you today is a call to action. I believe all of us agree that what we would want for all of us is to create positive, caring, safe, consistent environments. Many of us have had the privilege that that's what we live within. Others do not have that same level of privilege. So it will take all of us, all sectors, all strategies, and all people. We brought before you 3 strategies that are evidence-based that actually work to support creating positive, caring, safe, consistent environments. And again, I didn't highlight that 4th leg of the 3-legged stool to make it a 4-legged stool. That's the policy piece relative to gun safety laws. We presented you an overview of engagement since this work started in 2013. We do need to advance and invest in all of these strategies. They are depending upon each other. We will be hosting a follow-up session with a panel of representatives. And I do want to recognize Gwen Angelette, who's joined us tonight. She will be part of that panel. She more or less has put a lot of sweat equity in authoring this level of community-driven, along with the other partners I recognized, to really advance a community-driven intervention prevention strategy. What we are asking of you is to stay engaged, to stay involved, to stay educated on the impact of the strategies to date, and to advocate for this comprehensive approach relative to eradicating gun violence. Next slide. And some of the specifics that we want to bring to your attention, and you will hear more about this a week from today, is to reach out to our key decision makers and to request that they commit to this comprehensive approach. And commitment, beyond just the words, but also the resources, bringing equity, bringing investments to this approach to eradicate gun violence and heal our communities and focus on our future by addressing the concerns of our youth. Those who have influence are those who are in office, inclusive of our mayor, city council president, county exec, our cabinet secretaries at the state level. So Lynn and I wanted to kind of just give you the landscape and then invite you back next week where the Wilmington Community Advisory Council partners will share the proposal in more depth that they are putting forward to really create this community-driven intervention. I do have my email here because what we want to be able to do is to have you sign up through my email as a community member committed to being engaged with this ongoing. Again, it takes all of us to really address the health and well-being of our neighbors, and especially those who are impacted the most directly by the disease of gun violence. Lynn, I'm going to turn it back to you.
Sure. Before asking for questions, I'll just give a couple other sort of housekeeping things. For anyone who would like to get a reminder next week about the presentation and the Zoom link, which will be the same as this week's Zoom link, if you just put your email in the chat, we can be sure that you get that information. Additionally, if you have an interest in getting on our distribution list for hearing about our every Thursday classes and learning more about what our Peace and Justice Work Group does, just make a note of that in the chat and we can add you to that distribution list as well. A final way of taking action now and raising your voice towards wanting to see more investment in gun violence prevention and intervention programs would be to come to the March for Justice on Sunday. So that is a March for Justice that is being sponsored by Pachman Terrace. It will be at 3:30, starting, let me make sure I get this right. And so you can go to the Peace Week website to get more information about it. But gathering at 18th and Baynard at 3:30 on Sunday, walking to Rodney Square. So the event will take place at 4 o'clock in Rodney Square. We're hoping folks will come with signs about what is near and dear to your heart. So for this group, I would hope you would create a sign saying, invest in community-based violence prevention programs, and whatever else is near and dear to your heart. I know that as part of that event, they have invited the Wilmington mayor and city council to attend and come here and listen to what the public has to say. I think they plan to pass a microphone down the line so everyone can give their 10, 15 seconds about what they care about and make their pitch. So that'll be your first opportunity to advocate for investment in these community-based programs. So with that, let me throw it open to questions.
Roger?
There was an article in the paper today about $1 billion that the state of Delaware is getting on the basis of, well, it was one of the early programs passed probably in 2020 for COVID relief. And sounds like some of the programs you've got here are prime candidates for funding in that area, particularly if it focuses on employment, education, and some other aspects that you've touched on. Is that the case, or am I mistaken?
Yes, I believe that is the funding that they would like to, get part of with this proposal that's being put together. So that is exactly the bucket that this will be targeting. And Gwen, feel free to jump in and add any nuance to that answer if you'd like.
Yeah, I'd be happy to do that. There was an RFP announced today by the governor for nonprofits to apply for funding. The way we read the proposal, it seemed like it was really targeting capital projects. And I'm not sure that our project would qualify as a capital project. I don't know if there are going to be other funding streams that they're planning to use, but that's what we saw today.
And Roger, that's part of the coming together and strategizing on how do we resource this level of engagement, and how do we do that over time as well. You know, this level of gun violence, as you saw through our history, didn't just happen overnight, and so it's going to take a long term investment strategy also to promote these programs and interventions, that they get integrated in almost to like the way of us doing our practice.
It seems to me, and I'm a casual observer of some of these things, is that what you only touched on age of the gun violence, where the gun violence is being committed. But over the period of time, it seems like the role of social media, unfortunately, has come to be a stronger and stronger incentive for retaliatory actions, for jealousy, and for other things. And while we saw the gun violence in 2015, which was the result of, which triggered the CDC result, my guess is social media didn't play the role it did in 2015 that it does now. So we're seeing a shift for incentives for violence from one group of things to another. And I don't know, does that help understand it, or maybe provide a key to attacking it? Because I've seen that even in a political sense, peers, you listen to your peers more than you listen to authority figures, or listen to adults, listen to anybody else, but your peers are what triggers your action, which is, well, disturbing when your peers are 15 and 14-year-olds. And as you say, the brain development isn't there to comprehend a lot of things.
Yeah, exactly. Yep. And I think our panel next week, Gwen, would you agree, could probably share more information about the impact of social media?
Yeah, we'll absolutely be able to do that. You'll be hearing from Daryl Chambers, who is the director of the Center for Structural Equity, and he is really on the ground every day. And he'll be able to speak very definitively about the change and how communication has really affected. And we also agree that it has escalated, the gun violence that we see. And it's also been exacerbated by the pandemic and things that happened to young people over the last year and a half, and disconnection from schools, disconnection from other support systems. There's just a lot in play here, and we're seeing the unfortunate results of that.
Yeah, because if you attack what the causes were for the CDC study in 2015, you might be missing the point of today's issues, which, as you just so rightly said, based on the COVID epidemic, the lack of school, social media problems, and all that. So I don't know how things. I think you're attacking it from so many different standpoints. You'll get it, but it's important to recognize is the changes that have occurred.
Yeah, much of the underlying stuff is the same, but as we've learned, social media amplifies things. COVID has amplified things and brought them to our attention. So much of the underlying, and with the youth, a lot of it comes down to the respect. And if they're disrespected, they're going to reach out and take what seems like unreasonable action to us in terms of the violent nature of it. But now that disrespect they may feel, which before may have just been a bump in the hallway, now it's something posted out where everyone can see it. So there's even, it's felt, it magnifies it. It's felt, that disrespect is felt even more strongly. So it is, a real contributing factor. The social media, though, also gives a way to analyze from a little bit of a distance social connections and network. which we now understand is a key factor in understanding who's driving what and how to prevent and intervene things from happening. So it does give another window into things and possibly a way to use that information to help with prevention and intervention strategies.
And also, I think we shouldn't forget police reform, which has the great, as much on one hand, as it has on the other. I mean, we talked about the people who are committing all the violence, but let's talk about police reform at the same level, because we're not doing any good if we don't.
Absolutely. I mean, many of the issues with police are part of what leads to the disenfranchisement of the folks who are, the perpetrators and the victims of these crimes. So it's all connected. The distrust that many, and particularly the victims and perpetrators of violence, the distrust they feel of the police is just one more thing that adds to the whole problem.
And Lucy, that's also why the community-driven intervention side of it needs to be recognized as well, right? Because the community-driven is that grassroots approach to supporting that community.
Are you going to be, this is Pam Finkelman, are you going to be depending on volunteers, hiring professional people? I mean, it's hard for me to get a grasp on what kind of numbers you're talking about is to make all of this work well, or are there community groups already in place, ready to go? I mean, I don't quite understand the logistics of that.
Yeah, thank you, Pamela, because this was that's why we want you to come back next week. Because you will be hearing the logistics around that level of execution, but it is to already leverage the grassroots organizations and to empower and provide additional resources and assets in hiring, also in training people from the community itself to engage at this level of work. But part of this is why we wanted the double session. Part of this was to kind of give you the historical perspective relative to when the CDC was here, how the world has changed since that work was done, and then looking at what are these intervention strategies. And Lynne has more or less dedicated herself in this work, and even has gone to conferences where they have talked about this three-legged stool approach relative to having comprehensive. We want to lean in stronger on that community driven. So next week, you'll be hearing more about logistically, how will this be deployed on the ground in a more intentional way.
But just to be clear, it does go way beyond volunteers. These programs need to be resourced in a way that full-time employees can be hired and trained. So yes, there is a level of expertise that is required, but part of what is also required for many of these positions is having that street cred and the knowledge of the community. So it does involve hiring people from the community where they already know the people and are part of and embedded in those communities, and then giving them the proper training and resources to do the job.
Thank you.
Thank you, Pamela.
So we look forward to seeing you all back next Thursday.
Yeah.
As we move to action. This was the background, this was the context, and then the work to be done. The rubber meets the road. So we look forward to your joining us next week. As I said, tonight's program has been recorded. It will be on the Westminster YouTube channel. So particularly for those that who are so active in Peace Week and Peace Week Delaware, who might have missed this evening's program because there were so many competing events underway, or even given what each of us has learned tonight and believe would be helpful for others in our social networks and group organizations to become aware of what's involved, what's at stake, and what's possible. Please share the link with them as well and invite them to come next week. We look forward to seeing you. And thanks again to Rita and Lynne for the program.
Thank you for the opportunity.
Thanks, everyone.
Fantastic. Thank you.
Wonderful.
Thank you.
Thank you.
Good night.